So what are those wishes that is coming to your mind at this time? All right. The first one is you want your wife to be here before your last breath. Consider that done. We are going to do that for you. All right. Which other thing? You want your dogs to also be here with you. There is no problem. We're going to make provision for that. With your express permission, the social workers will be notified as soon as possible. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene following the 7th step of WHO standard and pour amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean. I will allow my hands to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? The reason why I'm here is to carry out a full set of observation on you, following A to E approach, and to ask you a few questions about the activities of your daily living. Is it a convenient time, please? All right, thank you. So before we continue, could you please confirm your full name and date of birth while I double check with my paperwork as well as against your wristband, please? All right, I have Janet James. Janet James. Your date of birth is 0101-1992. 0101-1992. Your hospital number is 1234567. 1234567. All right, assessor, I can confirm I am with the right patient. All right, Janet, are you allergic to anything at all? All right, you have no known allergy. It is properly documented in my notes that you have no known allergy, and that is why you are not on red wristband. All right. How may I address you, please? Okay, Janet. All right. So, I'm going to be leaving you with a call bell now while I go and assemble my equipment. If you need anything, just press on the call bell and I'll be here to attend to you. Is that okay? All right, thank you very much. Leaving my patient's bedside, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, assessor, could you please confirm my equipment are clean, calibrated, and are ready for use? All right, thank you very much. Okay. All right, Janet, I'm back. Are you still happy for us to continue? All right, thank you very much. Okay, so I'll be starting the assessment with the full set of observation. Then we go to A to E approach. Is that okay? All right. So starting with your blood pressure, which of the arms would you prefer for the cuff to be tied on? All right. Okay. So have you had any surgery done on your left arm previously? Oh, fantastic. So checking the arm, I can see the arm is visibly clean. There's no skin lesion, no edema, no inflammation of any kind. I will go ahead now to tie my cuff 2 to 3 centimeters away from the cubital fossa, making sure it is not too tight and it's not too loose. However, Janet, in the process, you may feel a little tightness. I don't want you to be perplexed because it's going to be momentarily. Is that okay, Janet? All right, thank you very much. I'm not going to start the machine right away. Can I touch your other hand, please? All right, fantastic. So I'm going to be depressing your finger now to check how perfused, how well perfused you are. Is that okay? So looking at the fingers, I can see the fingers are visibly clean, no skin lesion, no edema, no inflammation of any kind, no forced nail, no nail varnish. All right. So I'm going to be depressing your finger for 5 seconds now. 1, 2, 3, 4, 5. All right. I'm happy it returns back in less than 2 seconds, meaning you are properly perfused. Then I will put my probe now. All right. And start the blood pressure machine immediately. Okay. So I'm going to be noting the reading. All right. I will unwrap the cuff now and keep it. I will clean after I'm done. All right. I will take the pulse oximeter also. I want you to remain silent for the next 2 minutes, and I will also be silent too. This period, I will not be able to talk to you. I'll be checking for your heart rate. All right, if that is okay by you. Thank you very much. So I'll go ahead now and palpate your radial artery, right? So assessor, my time starts now. All right, I will assume the 2 minutes is complete, but please do not assume during your exam. All right. So I'm sorry, Janet. I actually counted your heart rate for 1 minute and your respiration for another 1 minute. I was intentional about not informing you because once patients are informed, they tend to alter the reading. So to avoid this, that is why I did not inform you prior. Okay, so I'm sorry for that. All right. So here is an infrared thermometer. It's a device to check your temperature. It's not to harm you, and it's not going to have direct contact to your skin. All right. So looking at your forehead, I can see there's no excessive sweating and no skin lesion, no edema. I'm happy to check your temperature. All right, so I'm going to note that reading as well. All right, thank you for your patience. That brings us to the end of the vital observation. All right, so moving on to A to E assessment now. Since the beginning of this procedure, I can see you've been communicating with me normally, but I wouldn't want to assume all is well. To further establish this, could you please make a cough, please? Oh, fantastic. Can you take a deep breathing breath for me? Oh, good. Assessor, I can confirm Janet's airway is patent. All right. Moving on to breathing, I checked the other time for your respiratory rate, the depth and the rhythm, which was okay. There was nothing sinister. As for respiratory noises, there was no wheeze sound heard, no stridor, and no coughing. All right. And the rising and falling of your chest was happening bilaterally at equal rates, meaning there is equal air entry. All right. So I'm okay with that. Checking for visual signs of respiratory distress, there were none identified during the time I assessed you. There were no use of accessory muscle, no seesaw breathing, you were not breathless, and there were no excessive sweating. I'm happy with that. Regarding your oxygen saturation level, you are saturating on air at 96%, which is within normal therapeutic range. I'm happy about that. Moving forward to C, which is your circulation, the other time I checked for your capillary refill to know if you are perfused or not, it refilled in less than 2 seconds. It does mean you are properly perfused. And your extremities are warm to touch. You are not extremely cool and you are not overheated. All right, I'm happy with that. Okay, so your pulse rate was okay at 72 counts per minute, which is still normal within normal therapeutic range. The strength and the rhythm was still okay also. So your blood pressure too was okay at 120/80 millimeter of mercury. I'm happy with that also. Moving on to D now, which is disability. Janet, if I may ask, do you know where you are at the moment? Oh, fantastic. You're actually in the hospital and you're very correct on that. Yes. All right. And do you know who I am? Yeah, I am the nurse. You are correct. Yeah, well done, Janet. Okay. Do you know what time of the day it is? Oh, actually, it's actually afternoon. Fantastic. Meaning you are oriented to time, place, and person. I'm happy about that. When was the last time you visited the loo, Janet? Oh, in the last 1 hour. Oh, fantastic. That's good. Hope there was, do you experience any difficulty maturating? Not at all. Okay, I'm happy to hear that. All right. Okay, so when was the last time your blood glucose level was checked? Oh, okay. Were you told the value at all? You weren't told. Okay, I'm going to check your or assessor. Could you please confirm my patient's blood glucose level? Oh, within the normal therapeutic range. Thank you very much. So I was told it is normal. Okay, I'm happy with that. All right. Janet, if I may ask, are you in pain, in any form of pain now? Oh, so sorry to hear that. On the scale of 0 to 10, 0 being the least and 10 being the highest, how will you rate your pain at the moment? Or you will say 7. Oh, that's quite high. Assessor, Janet is in severe pain right now. If it were to be a real clinical scenario, I would have loved to stop this I'm doing and attend to Janet. But for the sake of OSCE, could you please allow me to continue? All right, thank you very much. Oh, can I reposition you, Janet? Oh, so sorry. Could you please take a deep breathing breath for me? Do you feel any better? Oh, so sorry to hear this. I'm going to check through your match chart in a moment to see if any analgesic is prescribed, and if not, I'm going to be escalating your care to the medical team, and they will, as soon as any analgesia is prescribed, I will come back to attend to you. Is that all right? Okay, thank you very much. Okay, are you still happy for me to continue? All right, thank you very much. Moving on to E, which is exposure. I checked for your temperature the other time, it was normal at 37.2, which is okay, still within normal range. All right, and then the past exposed on your body, Janet, I cannot see any sign of bruises, bleeding, or injury. Could you please confirm with me if there is any place in your body covered that you are having sign of bleed, injury, or bruises, please? Oh, none at all. I'm happy about that. And looking at your past medical history, Janet, I could see you are a known diabetic patient and you also have hypertension. Am I correct? All right. How has drug compliance been with you? Okay, all right. I know it could be difficult to take medication, but I just want to encourage you to still keep up with that. Is that okay? All right. Okay. So I'm going to be stepping aside now to document what I've done, and I'll be back in a moment to ask you some more few questions. Is that okay? All right. Thank you very much. So stepping aside from my patient, I go ahead to perform my hand hygiene following the 7 steps of WHO standard. All right. I'm back, Janet. From the news total that I got, you're scoring 0, meaning the frequency of monitoring will be 12 hourly. All right. It is nothing to be worried about. Everything is under control. Is that okay? All right. Few questions, Janet. I could see in your scenario that you are dying. Oh, I am so sorry to hear this. I know how it feels. And I know how you feel right now. I am so sorry to hear this. Do you have any special wish you would want to make at this point in time? And I want to assure you that every of your wishes is going to be taken care of. Whatever you need to be done, we are going to undo it as fast as possible. So what are those wishes that is coming to your mind at this time? All right. The first one is you want your wife to be here before your last breath. Consider that done. We are going to do that for you. All right. Which other thing? You want your dogs to also be here with you. There is no problem. We're going to make provision for that. With your express permission, the social workers will be notified as soon as possible. They will get your dog to you as soon as possible. Is that okay? All right. Any other thing, any other wish at all? What other thing do you want us to do for you? Concerning the pain you are in, like I said earlier, I'm going to check through your match charts to know if you are due for any pain medication. And if not, I'm going to be escalating your care. And as soon as medication is prescribed, I'm going to come back and administer that to you. Would that be all for now? Okay. All right. Everything you've asked will be done for you. Is that okay? Thank you very much, Janet, for your time. I really appreciate your time. And I will see you another time. If you need anything, here is the call bell. Do press on the call bell and we'll be here to attend to you. Is that okay? All right. So leaving my patients now, I'm going to clean the used equipment, prepare them for the next use, perform my final hand hygiene following the 7 steps of WHO standard.